Did you know that just one wrong blood pressure reading could put you on medication for life, when the real problem might actually come from your daily lifestyle and diet? My name is Ethan Marshall. I'm 60 years old, a cardiologist living and working in the United States, with more than 3 decades in the field of medicine. I want to begin today's conversation with a question that might surprise you. Did you know that simply checking your blood pressure on the wrong arm could give you such an inaccurate result that your doctor might prescribe medication you don't actually need? It sounds unbelievable, but I've seen it happen to more patients than you might think. Before we dive deeper, I'd like to ask you to take a moment to subscribe to the channel, hit the like button, and share this video so more people can access reliable, life-saving health information. Your support truly helps me continue creating meaningful content like this. Now back to our question. Which arm should you use to measure blood pressure, left or right? It seems like a simple question, but the answer is far more complicated. Many people assume the left arm is more accurate because it's closer to the heart, while others believe the right arm is steadier since it's the dominant arm. The truth is, there's no golden rule that guarantees one arm is always correct. The reading you get doesn't depend only on which arm you choose. It's influenced by many other factors. How you sit, whether you relax before the test, if the cuff fits your arm properly, and even the height at which you rest your arm. A small mistake in any of these details can throw off your results. I've seen patients whose numbers change dramatically simply by shifting arm position or taking a measurement while still stressed, creating differences big enough to cause serious confusion. So why does this seemingly minor question matter so much? Because the numbers on that monitor are more than just data. They're the foundation for critical medical decisions. Whether you need medication, whether your treatment plan should be adjusted, and how aggressively your condition should be managed. If the reading is wrong, you might end up on an unnecessary prescription. Or worse, miss the chance to intervene before real danger strikes. That's why understanding the context and principles behind blood pressure measurement is something every person should know. Now, I want you to imagine this situation. If your doctor asked, "Which arm do you usually measure your blood pressure on?" How would you answer? Would you just go with your habit? Or would you know that the correct approach is to measure both arms during your first visit? This isn't just a medical detail. It's also a way of testing how proactive you really are about your own health. To kick off today's conversation, let me leave you with one simple question. When measuring blood pressure, which arm do you think always gives the correct reading? A. The left arm because it's closer to the heart. B. Neither arm is absolutely correct. You should check both and compare. Share your answer in the comments below. I look forward to reading your thoughts and continuing the discussion with you. In clinical practice, what may seem like tiny mistakes during blood pressure measurement can lead to consequences far beyond expectations. Something as simple as a slightly loose cuff or a patient drinking coffee just before the test can cause readings to differ by as much as 10% from the true value. At first glance, that number may not sound significant, but in medicine, such a difference can determine whether a patient is diagnosed with hypertension or considered within the normal range. From there, a small error can trigger much larger consequences. A patient may be prescribed medication they don't truly need, or a treatment plan may be adjusted in the wrong direction, exposing them to potential side effects, unnecessary psychological stress, and financial burden. This is precisely why international health organizations emphasize accuracy in blood pressure measurement as the foundation upon which all medical decisions must be built. During the very first measurement, checking both arms is a step that must not be skipped. If the results show a difference of 5 millimolars or less, the patient can be reassured that this discrepancy is clinically insignificant. However, when the difference exceeds 10 milliliters, it is no longer a random occurrence. Instead, it becomes a warning signal that there may be underlying vascular abnormalities, ranging from arterial narrowing due to compression to obstructed blood flow. Ignoring this sign means missing the opportunity to detect early cardiovascular diseases, conditions that remain the leading causes of stroke and premature death in adults. We need to recognize that errors in blood pressure measurement are not just about the numbers flashing on the monitor. They can alter the entire trajectory of treatment. A patient misdiagnosed with hypertension may face long-term consequences. Unwanted side effects from antihypertensive drugs such as dizziness or orthostatic hypotension, or even a dependency on medications the body does not actually require. Conversely, a patient with real hypertension who is underestimated due to inaccurate readings is left vulnerable as the disease silently progresses without timely intervention. Therefore, following strict procedures and minimizing sources of error is the key to reducing the risk of misdiagnosis. The story of differing blood pressure readings is not simply about whether you measure on the left arm or the right. It is a reminder of how fragile the process of health assessment can be. It underscores the essential role of precision and caution in every step of measurement, from preparation to recording the result. Both patients and healthcare providers must understand that every small error can create a weak link in the chain of care, leading to outcomes that could have been entirely preventable if the initial measurement had been performed correctly. The medical principle of selecting which arm to measure blood pressure on has been clearly established through extensive research and endorsed by leading international organizations. After a patient has had their blood pressure checked on both arms during the first assessment, the arm with the higher reading should be used for long-term monitoring. This rule is not arbitrary. It is grounded in strong scientific evidence. Choosing the arm with the higher value helps doctors avoid underestimating a patient's true blood pressure. If only the arm with the lower reading were used, an underlying case of hypertension could be overlooked, leading to delays in diagnosis and treatment. For this reason, the method has been supported and recommended by highly respected institutions such as the American College of Cardiology and the American Heart Association, both of which have repeatedly emphasized the importance of standardizing blood pressure measurement protocols in their official clinical guidelines. Beyond simply deciding which arm to use, differences between the two arms carry significant clinical meaning. If the discrepancy exceeds 10 mmHg, physicians must remain vigilant. In younger individuals, this difference is often related to mechanical factors, such as a muscle group or an anatomical abnormality compressing the brachial artery, which restricts blood flow and creates a measurable imbalance between sides. While typically congenital or posture-related rather than degenerative, such findings still require careful evaluation to ensure no hidden risks are missed. In older adults, the cause is more frequently linked to atherosclerosis, a progressive condition in which cholesterol-rich plaques and fibrous deposits gradually accumulate inside the arteries. The consequences extend beyond localized obstruction, heightening the risk of myocardial infarction, stroke, and peripheral artery disease. Even a seemingly simple disparity in blood pressure between arms can serve as an early indicator of far more serious cardiovascular events, and physicians must never dismiss it. In rare but critical situations, a significant interarm difference may point toward an aortic dissection. This life-threatening emergency occurs when a tear develops in the inner lining of the aorta, the body's largest artery, allowing blood to flow between its layers and create a false channel. Such a complication can rapidly lead to death if not recognized and managed immediately. For this reason, clinicians faced with large discrepancies must not ignore the finding, but instead order appropriate imaging studies or refer the patient to specialized care as needed. Thus, the principle of selecting the correct arm for blood pressure measurement is far more than a routine technical step. It ensures diagnostic accuracy and also acts as an important screening tool for underlying vascular disorders. By adhering to this recommendation, physicians lay a strong foundation for all subsequent treatment decisions, while simultaneously creating opportunities to detect dangerous conditions early, reduce risk, and safeguard cardiovascular health over the long term. In clinical practice, proper blood pressure measurement plays a critical role in ensuring the accuracy and reliability of results, serving as the foundation for all diagnoses and treatment decisions. First, patients should avoid stimulants such as coffee or tobacco for at least 30 minutes before the test, as both can temporarily elevate blood pressure readings and distort the true value. Next, the patient should rest quietly in a calm environment for about 5 minutes to allow the cardiovascular system to stabilize. Any stress, rushing, physical exertion, or conversation right before the test can accelerate heart rate and artificially raise blood pressure, producing results that do not reflect the patient's actual condition. Another important factor is choosing the right cuff size. According to international standards, the cuff should cover at least 80% of the arm's circumference to ensure even pressure distribution, neither too tight nor too loose. The cuff must be placed directly on the skin rather than over clothing, as fabric may interfere with accurate pressure transmission. During measurement, the patient should sit in a sturdy chair with their back supported, spine upright, and both feet flat on the floor, avoiding crossed or tucked legs, which can alter circulation and skew the readings. The arm must rest at heart level, supported by a table or pillow to prevent muscle strain. Throughout the process, the patient should remain completely still and silent, since even small movements or speech can cause fluctuations in arterial pressure. As for procedure, at least 2 consecutive measurements should be taken with a 1 to 2 minute pause in between. If the results differ by 5 milliseconds or more, a third measurement is recommended to establish a reliable value. All readings should be documented carefully, including the time and context, to serve as a basis for long-term monitoring. From a diagnostic perspective, a single unusually high reading is not sufficient to confirm hypertension. International guidelines require multiple measurements at different times, or consistent monitoring at home with a personal blood pressure monitor, to rule out temporary factors such as stress or white coat hypertension, a phenomenon where patients only show elevated blood pressure in a clinical setting due to anxiety, while home readings remain normal. These rules are not just technicalities. They are safeguards against systemic errors that could lead to misdiagnosis. They protect patients from unnecessary medical interventions while ensuring physicians make accurate clinical decisions. What seems like a simple blood pressure check is, in reality, a process that demands absolute precision, as it sets the stage for treatment strategies that may shape a patient's care for years to come. For that reason, strict adherence to standardized procedures at every step is an essential condition for protecting cardiovascular health safely and sustainably. From a broader perspective, measuring blood pressure is never just about a technical step or a number flashing on a monitor. It also reflects how we understand and care for our bodies. Modern medicine makes it clear that choosing the arm with a higher reading and following standardized procedures is the foundation for accurate diagnosis and timely treatment. Yet stopping there only addresses the surface. Clinical evidence shows that our blood vessels and heart are profoundly influenced by daily lifestyle and diet. Here, Arnold Ehret's philosophy in rational fasting, healing through diet, adds a different dimension. He argued that the buildup of mucus in the body, caused by consuming excessive processed foods, refined starches, and animal products, is the deeper reason blood becomes heavy, and vessels lose their flexibility. When blood loses its natural purity, blood pressure not only fluctuates, but may also show differences between arms, signaling circulatory disorders. The combination of modern medical science and this nutritional philosophy offers a powerful message. We cannot rely solely on medication or measurement technique. We must go further and address the root causes in our daily habits. By cutting down on industrial foods, limiting red meat, and increasing fresh vegetables, fruits, and clean water, anyone can help improve the purity of their blood, reduce strain on vessel walls, and make blood pressure readings a truer reflection of overall health. This does not diminish the value of clinical medicine. Instead, it complements and enriches the significance of accurate measurement. When the body is healthy from within, the numbers we record also become more stable and reliable. The conclusion is clear. Measuring blood pressure correctly tells us where our bodies stand. but balanced eating and living provide the long-term path to keeping the heart and vessels strong. Each reading can be seen as a mirror, reminding us of the need for precision in medicine and the importance of lifestyle changes. By combining both approaches, rigorous adherence to medical protocols and nourishing the body with the purest, most natural foods, we can prevent life-threatening complications like stroke and heart attack, while building a lasting foundation for whole-body health. This is the path of balance. Modern science provides safety, while the healing through diet philosophy offers sustainable depth, working together to protect life. So let me leave you with a question. Which habit do you believe is more important for protecting heart health? Measuring blood pressure the right way, or changing your daily diet? Share your thoughts in the comments below. And if you'd like to learn more, don't forget to fill out the form in the description to receive your free ebook on healing health. To support this channel in continuing to bring valuable knowledge, please hit subscribe, like this video, and share it with your loved ones.